Your skin is thin and crepey, and you have dark circles that no filler has ever fixed. You're probably seeing two words all over your feed lately: polynucleotides and PRF. And honestly, what's being said about them online is either oversimplified or they're just selling you what they have in stock. I'm not going to do that. I'm a physician assistant trained in neurosurgery before I even picked up a syringe. I'm going to tell you the actual difference, the mechanism, the cost, the downtime. If you're new here, I'm Suzy. I'm a neurosurgery PA in New York City, and I am the founder of Elcin Aesthetics here in Manhattan on the Upper East Side, across from Bloomingdale's. I've spent over 20 years in medicine before aesthetics, and my whole approach is medicine and safety first. Cosmetics are second. I'm not chasing every new syringe that hits the market or every trend. I'm actually looking behind the science of it all and what your skin actually needs. Let's talk about polynucleotides and PRF, what they are, how they're different, and we can decide which patient gets what. Please hit the subscribe button below if you want to see the upcoming videos. Let's start with PRF, because I get asked about this constantly, and it's a treatment that I'm probably most known for. PRF stands for Platelet-Rich Fibrin, and is made from your own blood. We draw a small amount, just like a regular blood test. We spin it in a centrifuge, and that separates out the concentrated layers of platelets, growth factors, and white blood cells. These are suspended in a matrix of fibrin. Then I inject that back into your skin because it's 100% your own biology. There is no risk of allergic reaction and no synthetic material. Your body recognizes it instantly, and the growth factors in that fibrin layer signal to your skin to produce more collagen, improve circulation, and repair tissue. It's slower acting than a filler, but the results build over weeks, over time. They're incredibly natural because you're not adding anything foreign. You're triggering your own regeneration. PRF is what I use mostly for under eye hollowing, overall skin quality, texture. It gives you that glow from within that patients are always asking for. Now polynucleotides, this is what everyone is suddenly talking about. And for good reason. The science is exciting. Polynucleotides, they are purified DNA fragments, typically derived from either salmon or trout sperm cells. These are processed into an injectable gel. I know how that sounds, but stay with me. The fish's DNA isn't recognizable as foreign. It's broken down to fragments that your cells recognize as signaling molecules. Once injected, those fragments act almost like a wake-up call to your fibroblast. These are the cells responsible for producing collagen and elastin. They almost help improve hydration, boost microcirculation, and have an anti-inflammatory effect on the tissue. Unlike filler, polynucleotides don't add volume at all. There's no plumping effect. It's pure signal and repair. This is why you're seeing them everywhere for under eye circles, crepey neck skin, post-procedure recovery. Anywhere tissue quality itself needs to improve, not volumize. So here's the difference between polynucleotides and PRF side by side, because this is what actually matters when you're deciding between them. PRF comes from your own blood, and polynucleotides come from purified marine DNA fragments. They're not autologous, meaning they're not from your own body. PRF delivers a broad cocktail of your own growth factors and platelets. Polynucleotides are more specifically, they're more about cellular signaling and hydration and less about the broad growth factor complexity that PRF has. PRF, because it involves a blood draw and has more volume, tends to have significantly more swelling and possibly bruising initially. Polynucleotides are typically a finer and more precise injection with less visible downtime. PRF requires an in-office blood draw and a spin, which adds time and cost to the visit. Polynucleotides, they come in a syringe pre-formulated, so the appointment itself is often faster. Honestly, for most patients, this isn't either or. I use PRF when someone wants a fuller regenerative response and doesn't mind the blood draw. Think about under eye hollowing or overall facial rejuvenation. And I use polynucleotides more for targeted hydration and skin quality. Think of fine line, crepey texture areas where volume was never the issue. Okay guys, so this is the part where nobody's selling you a syringe wants to tell you. Neither of these is automatically better. They're not competing. They're different tools for different problems, and sometimes I use them both in the same patient months apart, depending on what their skin is doing. If your main concern is overall facial volume loss and skin quality together, I'll lean more towards PRF. But if your skin concerns are fine texture, hydration, that tired, dehydrated looking skin under the eyes or on the neck, then I'll lean towards polynucleotides. Or if you had a laser or microneedling recently and you want to accelerate healing, both work beautifully, but polynucleotides are often gentler as a first pass. What I never do is default to whichever one is trending. That's not medicine, and that's marketing. I look at your skin, your overall goals, your budget, and your tolerance for downtime, and then we decide together what is best for you because of the science on how they work. Quick but important, safety. Let's talk about safety. PRF, because it's entirely your own blood, has essentially no risk of an allergic reaction. The main risks are the same as any other injectables: bruising, swelling, mild discomfort at the injection site. Polynucleotides have an excellent safety profile in all the studies that we have so far. Though, because they're not autologous, not from your own body, there's a small theoretical risk of a sensitivity, which is why it matters enormously who's injecting you. This needs to be done by a trained medical provider who understands facial anatomy, not by someone who took a weekend course. This is true of every injectable I talk about on this channel, but it bears repeating here specifically. So, polynucleotides and PRF, they're both regenerative, both about triggering your own skin's biology instead of masking it. They are completely different tools, and the right one depends entirely on your skin, what it actually needs, not what's trending this month. If you want to know which one is right for you, the honest answer is I can't tell you from a video. I need to actually see your skin. We can make that happen. Link in the description to book a consultation at Elcin Aesthetics here in Manhattan in New York City. And if this has helped you understand the difference, please subscribe. I'm doing a full series breakdown on every regenerative treatment out there. No hype, just what's actually backed by science. I'll see you in the next one. Stay tuned. We're doing a most frequently asked questions series. Both are used for under-eye corrections, but they address different root causes. PRF is often better for hollowing and volume-related shadowing. Polynucleotides are often better for dark circles caused by thin, dehydrated skin and pigmented adjacent discoloration. No, polynucleotides don't add volume. They work purely through cellular signaling to each cell to help improve skin quality, hydration, and collagen production. Most patients need a series of 2 to 3 sessions spaced several weeks apart for both treatments, with continued improvement over the following future months as collagen production is building naturally and gradually. It could be used in combination or sequential